can see the tonsil. لا لا. You buy something called isotope scan, isotope thyroid scan, iodine scan, yes. And this is another example of cleft palate and lip associated with midline facial defect. Midline facial defect associated with hypopituitarism. Any midline facial defect, the patient will be at risk of something called hypopituitarism. And when we have hypopituitarism, we might have TSH deficiency. Presentation of congenital hypothyroidism, as we mentioned, big tongue, macroglossia, prolonged hyperbilirubinemia, poor feeding, hoarse cry, decreased activity, constipation, umbilical hernia, dry yellow skin, large anterior fontanelle, delayed skeletal maturation. Also, congenital hypothyroidism should be screened, and there is screening of hypothyroidism. Congenital hypothyroidism, by the way, we have 25 years screening, and it's old technique in Saudi Arabia. But congenital adrenal hyperplasia are recent. But for congenital hypothyroidism, we have it for last 25. Who can tell me why we should screen for congenital hypothyroidism? We mentioned that congenital hypothyroidism have yellow skin, have coarse features. So why we should screen? Why we should screen? No. Huh? To prevent mental retardation, yes, but why we should screen? As you can see in the previous slide when we said the child is yellow skin, tongue, large tongue, so there will be features of hypothyroidism. Why you should screen? No, because the features you have seen, the features you have seen is present only in few babies with hypothyroidism. Most of them will be delivered normal looking. No yellow skin, no large tongue. Because of what? Why they born there? Because of the maternal hormone. And the maternal thyroid hormone will take also 1 week to 2 weeks to disappear. So if we didn't catch them from the first week of life, there will be maybe features, mental or retardation. That's why we screen everybody, even there is no features of hypothyroidism. Acquired hypothyroidism, the commonest cause is what? The commonest cause is what? Is Hashimoto. Hashimoto's. Do you know Hashimoto? Hashimoto is Japanese doctor who described this disorder. Due to what Hashimoto? Autoimmune destruction of the thyroid gland. So Hashimoto is autoimmune destruction of the thyroid gland. It is what? It is primary acquired hypothyroidism. What are the names of antithyroid gland? You remember when we said thyroid peroxidase enzyme? So this antibody against the enzyme. The antibody against the enzyme. The enzyme, the abbreviation of the enzyme is TPO. TPO is what? Thyroid peroxidase enzyme. And there will be another antibody called TG antibody. What is TG antibody? Thyroglobulin antibody. So the antibodies in the Hashimoto's, we have either thyroid peroxidase antibody or thyroglobulin antibodies. We might have acquired hypothyroidism due to treatment. For example, those who have radioactive iodine therapy, they might have acquired hypothyroidism. What are the features of acquired hypothyroidism? What are the features? Or let me tell you what is the difference in the feature. What is the difference in features between acquired and congenital hypothyroidism? What are the things different from congenital to acquired as a clinical features? Mental retardation. Acquired has nothing to do with mental retardation. صح? Congenital, there is mental retardation. What else? Time of presentation, yes. Congenital since birth, this is later on. Yes, what else? Now, large tongue. There is no large tongue in the acquired. In the congenital, there is large tongue. Yellowish present in both. Dry skin present in both. So in the acquired, there will be general slowdown. The patient will be slow, always lethargy, always sleepy, depressed, weight gain, cold intolerance, hoarseness, dry skin, constipation, general muscle pain, bone pain, brittle hair, menstrual irregularity, and in the females, when they have irregularity, they have what is called in hypothyroidism, what is called menorrhagia. They will have menorrhagia. Examination in the acquired hypothyroidism, they will have dry, pale, coarse skin, yellow skin as well. They might have periorbital edema. They might have generalized edema. When they have generalized edema, what is the name? Mixed edema. Mixed edema. Mixed edema is feature of acquired hypothyroidism. They might have bradycardia. They might have hypotension. They might have delayed relaxation of reflexes, constipation with megacolon, pericardial effusion, pleural effusion, congestive heart failure, hoarse voice, and myopathy. All these are features of hypothyroidism. Goiter is present in what? In congenital or acquired? In acquired. In acquired, yes. And usually, when we have somebody with goiter, we screen for thyroid. But by the way, goiter is present in what? In euthyroid. Goiter is present in hypothyroid. Goiter is present in hyperthyroid. So goiter, presence of goiter doesn't indicate hypo or hyper. But it needs, anyone with goiter, it needs to screen or do thyroid function test. But it's not a specific sign. This baby, this child actually, came last week to my care. Do you know what's the age of this one? This was 9 years of age. 9 years of age. This is neglected baby. This is a cretinism. A baby with congenital hypothyroidism or a child with congenital hypothyroidism who never came to the hospital, and their family were neglecting this child. 9 years of age. Who can tell me the features of hypothyroidism? Coarse features, hypotonia, frog-like position, mental retardation, short, very short, yes. Brittle hair, yes. Brittle hair, dry skin, poor feeding. شايفين الانجي tube? Poor feeding, yes. All these happen, and we screen this one. We make it actually in the literature as abnormal. Yeah. First. Yes, because they don't have identity, they don't have ID, they don't have iqama. So the family were worried if they present to the hospital, they will be caught and they will travel to their country. They are not Saudi. Sure. Last year came. This is another child who came to the clinic because of short stature. He was age 13 years of age. He came to the clinic because of what? Only present with short stature. And inshallah, when you have tutorial of short stature, I'm not sure you took it or not, you'll find that every child with short stature should have thyroid function test. Every child, even there is no coarse feature, even there is no bradycardia. Only short stature, we should screen for thyroid function test. And this is what happened to this child. We screened for thyroid function test, and the child was hypothyroid. When we started the child with thyroxine, see the normal, what has happened? The growth parameters of this child improved dramatically. So this child is having acquired hypothyroidism, present with short stature, improved by thyroxine replacement. Diagnosis in any child with congenital or acquired hypothyroidism, we should do TSH, T4, T3. In addition, congenital hypothyroidism, we should do something called thyroid iodine scan to see what is the cause of hypothyroidism. In acquired hypothyroidism, we have to do antibodies of antithyroid peroxidase antibodies and antithyroglobulin antibodies, as well as thyroid ultrasound. There is something called Euthyroid syndrome. Euthyroid syndrome, that means if you have sickness, you are a normal person with normal thyroid function test. When you do the thyroid function test during sickness, you might find TSH is low, T4 is low, and that will be misdiagnosed as hypothyroidism. So the thing we need to stress, don't do thyroid function during sickness. Otherwise, you might have something called sick euthyroid syndrome. What is the treatment? What is the treatment? Is lifelong thyroxine for congenital and for acquired hypothyroidism. For hyperthyroidism, you can read the slides because of the time. It is the opposite, completely opposite to hypothyroidism. نعم. Yes, yes. So if somebody, for example, having fever, ill, or somebody in ICU, somebody post-operative, stress, any sickness. If you did thyroid during sickness, you'll find TSH is low and thyroid hormones low. So you'll diagnose this child as what? As central hypothyroidism. And actually the child is not hypothyroid. That's why we should not do thyroid function test during sickness. Otherwise, you might be false diagnosed central hypothyroid. Pregnancy is not sickness. We are saying during sickness, any sickness. Yeah, the pregnant woman is not all, they have normal life. Menses maybe. Menses if this female having with menses stress, that's fine, but not during the whole menses. Yeah, no. This is mimic FSH, if we have too much FSH, not if we have little FSH. For the hyperthyroidism, I'll leave the slides for you to read it because we don't have time, as well as it is the same as in adult hyperthyroidism. The causes, the treatment, the same as adult, it's written all in the slides. So just you read it because we don't have time. خليه خلاص يطفي.